All right. So first we'll talk about patients, right? So there's several areas in which healthcare or digital health is helping patients within the healthcare system. One is in social support. So when we talk about social support, we're talking about things like messaging, right? So helping patients who might be patients with the same disease or going through the same thing to message each other and provide that social support to each other. There's also crowdfunding. So this is something that unfortunately is a big thing within the US where someone, say, breaks a leg, or well, actually more likely someone has cancer or maybe their kid has a rare disease and they can't afford to pay for it. And so they'll go on crowdfunding sites such as, well, I won't say anything yet. I'll just tell you what they are. So crowdfunding sites that'll help them pay for it. And then finally, there's online communities. So there's a lot of tools out there that are really helping patients form a community with each other and helps them really share some of the best practices that they've seen, share with some of the physicians that they've liked and would recommend, things like that. Does anyone know off the top of their head, and I'll do this with every section, anyone know any example of these that you want to mention? Yes. I think you're on mute. Let me. Okay, there we go.
Oh, thanks. It wouldn't let me unmute it. Like GoFundMe.
Yeah, GoFundMe. That was actually the one I stopped myself from mentioning. So GoFundMe is a good example. And you want to just explain a little bit about what that does within the healthcare system?
Basically, so anyone can make a profile for people to donate to, and a lot of people do it for people who have rare like diseases or people who have like spontaneous injuries they aren't equipped to pay for, and people will assist in that way.
Exactly. And that's something that really until I would say about 5 years ago, or at least a decade ago, just wasn't a thing. So if you couldn't pay for it, you had to kind of do like a door by door, selling lemonade, holding fundraisers, things like that. Doing that has become a lot more easy with the introduction of digital health. Okay. Now, so what I've done is I've created these technology storyboards. And I'm doing this with each section that we're going to talk about for the rest of this lecture. But an example that I want to go over in terms of social support is Patients Like Me. So Patients Like Me is it's basically a site for patients who are like each other. It was actually started by the brothers of someone who ended up being diagnosed, I believe, with ALS. And they wanted to figure out a way to get other ALS patients together, to learn from each other, to connect with each other, and to just help each other overall. So with this technology storyboard, I'm basically creating a framework through which you can describe a particular technology in digital health. And what we're going to do is use these storyboards for me to explain different technologies, but then at the end of each, patient, provider, payer, producer, I want you all to create your own technology storyboard. And I've got a link for you to do that once we get to the end of each section. So what is it? Patients Like Me. What problem is it solving? Well, patients, they're too often on their own. They have to go through their own patient journey, a lot of them call it. And because they tend to go, or at least before sites like this, they tend to go about it alone, you had a lot of reinventing the wheel. A lot of people going through pains that they didn't necessarily have to if they could only learn from someone else who had been through it before. So this is something that's for the patients. Their data inputs are basically their personal profile, symptom updates, things like that that they put in the platform. And the outputs are, through those inputs, they can get health tracking information. But then also, in a lot of ways, more important, they form this community. So they can share stories with each other. They can learn from each other's experiences and make their journey much more bearable as they go through it. So Storyboard. This is really what I'm doing here is first you set the scene, then you talk about what happens. What is the patient's story through the platform? So number one, a patient is diagnosed and feels alone. What happens next? They join the community for their specific disease. Then what? Well, then patients make friends, they learn about different treatments, and they track their health progression. And our desired outcome is that the patient feels less alone and is more educated about how to deal with the disease. So that's a storyboard in a nutshell. And Patients Like Me is a social support digital health service for patients in a nutshell. Any questions about that? This is basically being the format of the rest of today. Okay. Oh, by the way, if any of you have any stories that you want to share with regard to these sites, maybe your experience or an experience a friend had, obviously keeping their identity private, please speak up and feel free to interrupt. I don't mind interruptions at all, but I'd love to hear anyone's experience with these platforms. Okay, so beyond social support, there's also disease management itself, which is obviously very important. Here's where you have things like patient apps. There's also a new class of therapies that are being called digital therapies. And in fact, the FDA has come out with guidance of what is a digital therapy, what can it be, and what level of regulation is required based on what you're trying to do. So the concept of a digital therapy is basically, it's not a pill, or it's not an injection or a device, but it's just using digital technology in some way to mitigate, either behaviorally or through some other means, the bad effects of a disease. You see this a lot in diabetes, where behavior can really impact your outcomes in diabetes, especially type 2. Telehealth, right? This is something that we're very familiar with in this day and age with coronavirus. And then drug adherence. So things that can remind you to take your drug, because actually one of the biggest cause for low efficacy in approved drugs is that the patients either don't take it or they don't take it as prescribed, and therefore it doesn't end up having the intended effect. Anyone want to talk about any of these that they know of off the top of their head?
I actually have some experience with the drug adherence, like apps, I guess.
Mm-hmm.
So for, I think Christmas last year, I actually got my dad like a pill case that like will connect to the app on your phone. And then you can actually connect family members to the app too, so that I can see whether or not my dad has been taking his medications. Yeah. And then, so it's like pretty cool, but my dad hates it. Mm-hmm. But I like it. So I don't know, it's just an interesting story.
I think I'd heard actually that a lot of those drug adherence apps and products are more marketed towards the kids and the grandkids than the patients themselves. So that's kind of, I guess, a little bit of a window into that. Great. Anything else? The other thing I'd mention is that drug adherence is, you could also consider it IoT, which is Internet of Things. So when we talk about IoT, we talk about like a smart thermostat or a smart fridge, things that like will tell you, if you need to order new food. I don't know why anyone would want that, but with something like drug adherence, you could see why that might make sense. Okay. So for this technology storyboard, I want to talk about reset. So what problem is this solving? Well, addiction treatment needs to be very constant and consistent to be effective. So this is what you could call a digital therapy. Now, the data inputs are the attributes of their addiction, as well as their cravings in real time. So when they have a craving, they might put that into the app. The outputs are actual cognitive behavior therapy, usually mediated by a clinician. And then data for those clinicians to use to adjust their treatment regimen as needed. And this is actually an approved digital therapeutic. It was one of the first approved therapeutics, and they were able to show that usage of this app in conjunction with traditional addiction therapy was significantly, led to significantly better outcomes than just the treatment on its own. The storyboard is a patient begins with their addiction treatment. What happens next? They create their addiction profile and they start tracking their cravings. After that, the clinician tracks the recovery process in real time and adjusts as needed. So rather than adjusting, say after a monthly visit or something like that, they can adjust in real time and make sure that the treatment is as effective as possible. Finally, the desired outcome is increased chances of recovery due to more hands-on and constant therapy. So you could see, I hope, a way in which you could create a much more simplified version of this for your application of choosing, right? All this really is a patient is implementing or inputting when they have cravings and maybe a few basics like a survey about features of their disease. And then on the back end, you're just transforming that into advice. So it's only complex because everything's shrouded behind this curtain. The goal of this class is to lift that curtain a little bit so that you can see, oh, you know what? It's actually not that complicated to create something like this. Now, obviously what they have, they're $1 billion company. They've done years and years of coding on top of that to make it as smooth and user-friendly as possible. But when they started as a company, I guarantee you, they didn't have much. It was probably very simple and something that you all, I hope, can build throughout this class. Any questions on that? Okay, next, Internet of Things. So here we mentioned Maxine's grandfather's pill service is one of these, right? So you're taking something that is a thing that you use, and then you're basically zapping the data from that onto the cloud to help make it more usable and more effective. You also put things like wearables in this category. And a wearable is basically something that you might put on your wrist that might measure data from you, like your heart rhythm, sleep patterns, things like that. And then you can use that data for more effective healthcare decisions. Diagnostics. So existing diagnostics, like say a stent or a valve or something, you can build now digital on top of that so that they can be more effective. Like for instance, my wife's grandfather, he's got a pacemaker that wirelessly talks to the cloud and basically gives the current status of how things are going, and that automatically gets zapped over to the clinician, and if something goes wrong, you can get real-time intervention. And then that's also kind of along the same lines as monitoring, right? So it enables us, digital health enables us to better monitor what's going on with the patient in real time to be more effective. Anyone got any inputs or ideas or stories around Internet of Things?
I had a question.
Yes.
Would an insulin pump be considered a wearable and a monitoring device?
Great question. Yeah, I mean, I would certainly, I don't know that I'd call it a wearable, but I would certainly call it Internet of Things. So I would put it into that category because it's basically a thing that didn't used to be connected to the internet, but now they're creating insulin pumps that are connected to the internet.
Right.
And there's a lot of very cool progress that's being achieved in the diabetes field because of things like these insulin pumps, right? And those are sometimes being connected, to go back to digital therapies or patient apps, to these apps that can help the patient understand how their behaviors in real time, maybe they cheated and ate some ice cream. They can see how that's impacting their glucose levels, and they can use that to modify their behaviors in a positive way.
Okay, thank you.
Anything else? Anyone got any feedback or ideas?
Yeah, definitely.
Sorry.
So, oh wait,
You can go ahead.
okay. Sorry, Alvin. But anyway, no, I personally haven't, but my mom actually has. I don't know if this would be considered Internet of Things, but she's a pharmacist, and over the past couple of years, she's definitely noticed more of the ingestible pills that kind of double as a monitoring device. So
Yes.
the MySite being one of them. There were a couple others she told me about. I can't remember what they were, but she's definitely seen an uptick of those. So that was kind of the first thing that just popped into my head.
Yeah, that's very cool. And something like that, I think you could all create as well, right? Obviously, you'd have to fake the pill, right, for your project here. No one's going to be building a pill that has digital health communication capabilities, but you could pretend that the pill is sending some signal, and then what would you want to put on that app that would be useful if you were receiving some sort of signal from a pill, right? Maybe you figure out when it gets into the stomach, or you figure out when it gets into the bloodstream, things like that. So definitely think outside the box when you think about what your projects are going to be. But yeah, those things are very cool. And not only do they help with adherence, and they help with understanding how the pill is being metabolized within the patient, but they also help with something called counterfeiting. Is anyone familiar with drug counterfeiting and what's happening in that world? So this is a billion-dollar dark industry, right? So it's huge. You know, there's probably Pablo Escobars of drug counterfeiting out there. And basically what they're doing is they're creating fake versions of common drugs, like say Lipitor, and they're faking it. They're basically sugar pills, and they're selling it within, you know, to different countries, to different distributors, things like that. It's very hard to get a handle on which drugs are counterfeit or not. So a lot of companies are now putting digital signatures onto each individual pill to make sure that those drugs are in fact the real drugs made by, say, Pfizer, Merck, whoever, instead of a counterfeit drug. So very interesting stuff going on in that world. All right, so what I want to highlight here is Health to Sync. So this is basically about managing diabetes. And the problem that it's solving is that managing diabetes is very, very difficult. In fact, the NIH has determined that behavioral improvements with type 2 diabetes can reduce the disease burden by 80%. The problem is nobody really does it because the guidance isn't there. People are confused over what to do. Everyone's got advice coming from different angles of, you know, oh, you're going to lose your foot, or you can't eat apples, or you can eat apples. It's very confusing. So having something to guide someone with type 2 diabetes through their patient journey is very helpful. So the data inputs here are your glucose levels, your activities and your meals, and partners. So in this, you can actually work with partners, whether that be your partner in life, right, or a significant other, or say a good friend or a family member, and they help give you coaching, encouragement, and you also get behavioral advice from clinicians. So let's go through the storyboard. A patient has diabetes and they need to manage it better. They connect to the glucose monitor, which any diabetes patient has, and then they hook that up to their Fitbit to track their data, their activity data. After that, partners and clinicians can use the data inputs from their glucose and from their activity to motivate, encourage, and guide that patient. Finally, our desired outcome is increased behaviors that mitigate diabetes. So trying to get us closer to that 80% of reduction in disease burden that the NIH says that we can get simply through behavior. All right, any questions about that? I'll just highlight here. Can you see my, my cursor when I do this? Okay, good. So I don't have to use the annotate thing. All right, so you can see here's a very interesting user interface. So it's not that complex, but it's colorful. It gives the information in a very simple way that users are used to seeing, right? It looks like an app that they might use for a game or to keep track of their stocks or whatever they currently use these apps for, but this just happens to be for healthcare. And then here you can also see that they are able to leave a diary that helps them keep track of what's going on throughout their day. And then that is in turn communicated with their clinician so that the clinician can give them advice of, hey, you know what, maybe you should eat your dinner earlier in the night before you go to sleep because this is not, you know, when you eat these late dinners, it's impacting your blood glucose levels in a bad way. Things like that. All right, information. So with here, we talk about information portals. So where do patients go to get that basic health information before they speak to a physician? There's also health games that help inform patients. And there's also, on the other end, so we're not talking about health information, but health care information. How do we find the physicians that are most helpful to us? How do we find the insurance that most fits our needs? there's lots of information portals out there on the internet for patients. Anyone want to talk about an experience with one or one that they know of that they think is cool? Okay.
I'm not sure if I totally understand it exactly, but I think for the Find Physicians, with certain insurance groups, you can like go onto their app or their website or something and find like within a certain area, the specialty and all that, you can find the physician, and then, you know, later you can go on and search them up.
Yeah, absolutely. You know, one downside of this whole patient, provider, payer, producer interaction is that it's oftentimes difficult to know which doctors can I go see without getting a huge bill after I go see them, right? Who are my insurance companies going to pay for? And so a lot of these insurance providers have provided these physician portals that enabled me to find who is a physician who's quote unquote in network, who they'll actually pay for. Again, this is one of these things that it's kind of unfortunate that it exists, but having digital health can really help smooth that over and make it easier for us as the patients to find the right physicians for us.
Well, I just wanted to chime in too about, I'm not sure if this falls under information portals, but I know a lot of physicians use this app called Epocrates, and basically a database of medication. So it allows a lot of physicians to look up medications and know like dosages for different age groups and what's FDA approved, what's the right amount to give, and also interactions or dangerous interactions that can occur between one medication compared to another. And it's still an app on their phone that they look up and use during their regular hours.
Yeah, absolutely. Thanks so much for that. Epocrates is a cool one. And it goes back to what I talked about when I was talking about the history of, it used to be that physicians were really reliant on their knowledge or whatever's in their medical library in their hospital. With tools like Epocrates, they can really just look up, or they could input the symptoms of the patient or the criteria of the patient and figure out what might be the right diagnosis, the right prescriptions, what might be the wrong prescriptions because of maybe bad interactions with current drugs that the patients are on. So these are all very useful, both for, you know, I think on the patient end, as well as on the physician end. Okay, so I'll talk about the one that we all know, Webmd. So what problem is Webmd solving? Well, it's that reliable health information is hard to find. Patients usually use this for better or for worse. And what they do is they input their symptoms and their demographic info. And then the output from Webmd is potential diseases that they might have, as well as next steps. And I say for better or for worse, because oftentimes among those diseases, there's always cancer there. Even if it's a low percentage, it ends up freaking everyone out. And they try to mitigate that by saying the next step is talk to your physician. But I think sometimes that's difficult to do when you see cancer on a screen next to your name. So it's very useful when taken, you know, with the right level of seriousness, right? It's really a starter on your road to seeing a physician. So let's talk about the storyboard. If a patient feels symptoms, but they're not sure what's going on, let's say they have an upset stomach and a headache. The patient then enters those symptoms into a symptom checker, which then provides the most likely diagnoses in order of likelihood. The desired outcome is that the patient is given treatment options and questions to ask their physician. So that way they can go to their physician more prepared. They can really do a self-analysis to figure out, okay, well, they say maybe I have Crohn's disease, but do I have these other 3 or 4 symptoms as well? And then that just makes them more prepared to know what to discuss. You know, maybe they have to look up their family history because of what WebMD tells them, and then they can come to the doctor more prepared to get a better diagnosis. All right, so the last step in patients, this is just pure data. So as I mentioned a few times, as we're going through the history and we saw how healthcare has evolved, is one way that no one can deny is there's a lot more data out there than there used to be. There's data from the diagnoses, the tests that we can do. There's data from the wearables, all the mobile technology that we've got on us. There's data, more data than anyone can handle. So how do we deal with this? One, is how do we deal with the patient data? Two, is there anything we can do with blockchain? Blockchain really has a great application within healthcare, and that it enables us to share healthcare information at lower risk. It's still future stage, right? So we're still gonna have to wait several years for it to become anything in healthcare. But when we talk about data, we need to talk about security. And, can we have this data transmitted from one person to another, from patient to clinician, in a way that does not leave us vulnerable to hacking? And then lastly, EHR platforms. So I mentioned that through Obamacare, EHRs, electronic health records, are mandated throughout every hospital. They don't all do it, but if they don't do it, they're being fined. So most hospitals, especially the ones that you're going to in Los Angeles, have electronic health records, but they don't really know what to do with it yet. So it's like they've implemented, but now it's just kind of a burden for the physicians, and they're not using it to very much good effect. However, enter digital health. If we can start figuring out better ways to analyze all the data that are within those health records, we could really vastly improve patient outcomes. We can start changing the way that we pay for drugs to being more paying for outcome as opposed to paying per test. And we can also potentially just reshape the way that we treat patients. And that's something that we could never do before, because we never had the ability before to really analyze what's happening within a given health network at the population level. So that's what data enables us to do. This one's a little bit more obscure, but does anyone have anything they want to add of a cool data platform that they know of or have experience with?
I had a question again, sorry. Does this data apply to pharmacies? Because I worked as a pharm tech, and I know for pharmacies, we have to keep patient records for 10 years, and they just sat in boxes in the storage room. So would these apps and stuff apply to outpatient stuff like pharmacies and whatnot?
It absolutely does. I don't know if there's any effort being done to look at sort of the backlog of papers that are already there. I think that'd be very interesting. Obviously, it would take a lot of manual labor just to port that over to make it digital. But I know that data in pharmacies is huge, right? In fact, they're definitely using this for coronavirus right now, because the pharmacists are really the front lines for patients, right? Patients, and maybe coronavirus isn't the best example because that's just so acute. But with all other kinds of diseases like the regular flu, a lot of people only will see a pharmacist, or they won't go to the actual hospital. And so because pharmacists are the front lines for a lot of these patients, there's a lot of work being done to amalgate all the data that these pharmacists have built with these patients and the relationships with these patients to provide better clinical decision-making on behalf of that patient. So that there's definitely movements there. I'll look up to see if anything's being done on the data that exists in paper form, and I'll let you know.
I have a kind of a question. It's kind of like combining the data and information, I think. But I know my undergrad, the place I went on campus, they had a patient portal where they put all of your data and stuff, so you could send it back to your primary physician back home and stuff. So all your data could be put in one area, one physician, and it made it a lot easier that they knew they weren't your primary care, they didn't have all your information, so they made it very easy. Just put it all online and send it back wherever you want it. Is that kind of what this data is and stuff like that?
Yeah, absolutely. I think that's a very good example of data. It's sort of the portability of your health information. And there's a lot of problems with data portability. And some of it is, I think, market-based, right? If you're a hospital, you don't necessarily want your patient's data to go to a different competitive hospital. it's unfortunate that they think this way, but it's just kind of a fact of life for a lot of these hospitals. And so there's been efforts on the part of the government to try to break down those barriers between hospitals and make it mandatory that hospitals share patient data with each other, because that is so important, because we as people are not stationary, right? We're not going to stay at the same hospital our whole life. And so it's important to be able to, when we move to a different hospital, bring all of that data that they've got along with us.
I think like I have to agree with that, especially because like I work in an ER as a scribe, and like we've had patients come in and like prior to the visit they'll just say like, oh, like I've been here before, but like they won't tell us a story, in the sense like having like an EHR platform, you're able to go back in the chart and see like why the patient was there for their previous visit.
Yeah, absolutely. And maybe that's something that you want to work on with your prototype project. I think that could be really cool. Okay. Any other questions?
Yeah, I
Yes.
have a question regarding data or more blockchain.
Mhm.
How do like they protect the information from like if you want to collect the data, how do you protect like the patient from people finding out who you are?
So a lot of that is HIPAA, and or a lot of it's mandated by HIPAA, I would say. So HIPAA is that act about patient data, and how do we make sure that it's de-identified? And there's a lot of technical solutions for basically using encryption to make sure that there's not just some database that someone can access that it says, you know, Will has this disease and so on and so forth, but instead it's encrypted so that they'd have to really decode the protections that are in place in order to see that. There's also this idea of de-identification, right? So the idea is that you can enable third parties. So a lot of these data providers might be a third party that interfaces with the hospital's electronic health records to figure out population solutions, right? They might figure out, oh, these types of patients are more prone to this disease, and help the hospital that way. Now, if you are letting those third-party companies know, hey, Will has this disease, Steve has that disease, Mary has another one, that's really compromising their privacy, right? So what's allowed is they can use the data in a de-identified way where they can't actually connect it. You know, they've essentially blocked out the names, so that they can still provide their service of analyzing the population data without actually seeing who has what. And there's still vulnerabilities, though. I would not say that healthcare is in a good place in terms of protecting patient data. There's been hacks, and the hacks have really created a lot of problems and exposed certain patients' data. You know, fortunately, we haven't heard a lot of stories of patients being directly harmed by that, but the cost of a patient record on the black market is pretty high. So that just goes to show that the bad guys have a lot of interest in this sort of information. Now, when we talk about blockchain, I'd say the only thing you really need to know about blockchain, unless you avidly want to understand it, is that it decentralizes everything so that you don't have everyone's data in one place. Right? When everyone's data is in one place, like say UCLA Hospital, all a hacker needs to do is get into UCLA Hospital. UCLA Hospital might be very well protected and all that, but people can get in. It's doable. And once they get in, they get all the patients who are within UCLA's network. So the idea behind blockchain is each node, right? Each person's medical record is its own thing. And so a hacker would have to get at it individually. And so that just makes it a lot less, the payoff is a lot lower. And so hackers are just less interested in going after that. So as long as there's centralized large data caches, such as these hospital networks, that's where the hackers are going to go, just because the payoff is so much more. And all they have to do is find, one employee within the system who clicks on their link and exposes their access information. Does that answer your question? Okay, great. Yes.
Yeah, so I just wanted to kind of zoom out a little bit and bring this full circle. So with respect to all these 5 factors, social support, data, so on and so forth, from a marketing perspective, which areas do pharma companies focus on the most?
It's a good question, and it really depends on which companies we're talking about. I would say if we're talking about pharma companies specifically, the focus is very heavily on the disease management end. So what they want to have is, either digital therapies for themselves or digital therapies as companions to their existing drugs. Right? If you're a pharma company, you think about what drives your finances, and it's your drugs, right? So let's say I'm Amgen. I really care about my drug Repatha, which helps with heart disease, right? That there's a lot of competition going on between Repatha and Praluent, which are sort of the 2 state-of-the-art cholesterol inhibitors for people with high cholesterol that are at risk for heart disease. If I can come up with a good digital companion that helps make those patients' user experience much more effective, helps with their adherence, helps with their outcomes, then I can get a leg up and potentially really become the preferred drug for those patients. So I'd say, it really depends on who we're talking about in terms of companies. But if we're talking about pharma, the ones who are creating the drugs, I'd say it's really in this area, disease management. Does that make sense?
Yeah, perfect answer.
Middle might be the other side, data, right?
Yeah. Have you come across any trends that, from a marketing perspective, pharma is trying to move towards with respect to digital management?
From a management perspective, that's a good question. There's a lot of, everything's in flux right now. So pharma companies are still very behind, and they're playing catch up when it comes to digital. A lot of them had started sort of like VP of digital roles, and they're in the hierarchy, they fall in different areas. Sometimes they'll fall within a given department of therapeutics. So I believe Amgen, for instance, has a VP of therapeutics for heart disease, as an example, or for cancer, as an example. And they basically sit within the marketing team and help figure out what strategies can we engage digital for in order to improve the stickiness of our therapies. Now, more companies are starting to make this digital executive report directly to the CEO. And that just shows the increasing importance of digital within the healthcare ecosystem. And all of this is public. So if you're interested, I'd encourage you to Google Chief Digital Officer Pharma or something like that, and then just see what are the recent movements, because there have been a lot of movements simply because a lot of companies aren't really sure how to handle digital and where should it be? Should it be within R&D? Should it be within marketing? Should it be just its own department, or should it be all of the above? All right, so technology storyboard. Let's talk about Emblema. So this is actually a blockchain company that helps patients with their health data. So the problem is that patients actually don't own their health data. I don't want to get too much into this, but there's a movement within particularly a lot of rare disease groups of my health data as a patient is incredibly valuable. It's worth thousands of dollars to these pharma companies, and we don't see a dime. So Emblema is trying to help them input their health records and then also monitor their health as they move forward. And then in return, provide them compensation when the data is uploaded and securely shared to the research community, to the pharma community, so on and so forth. So the storyboard is a user might upload their health records and activity tracker data, and then the patient chooses whether or not they want to share it, right? They could say, hey, maybe I only want to share it with academic researchers, or I'm willing to share it with anyone who will pay me, or I'll give it to other patients, researchers who could use it for free, or something like that. They can set their parameters. And then when someone uses their data, they get these blockchain tokens that provide them access to healthcare services. The desired outcome is that patients are in control of their health data and they're compensated. Now, it uses blockchain, and you could make the argument maybe they're just using it because it's buzzy, right? But I would say that the main benefit that they're getting out of blockchain is it just enables them to seamlessly get compensation. If we were using credit cards or something, it would be very difficult for each researcher to do credit card transactions with thousands of patients because they want to use their data. But if you've got this token sort of system, you can automatically compensate them. The only downside of using the tokens is that what is it really worth? It's what you make of it. So they're still working through that. This is a very early stage company, but I thought it was a cool way to show you how data is being used on the patient's end. Okay, any questions on that? Yes.
You mentioned they receive blockchains. What are those?
So it's like a token. It's like a Bitcoin. Are you familiar with Bitcoin?
Yeah.
So it's like a Bitcoin, but it's their own version of it. Okay. And it only is given to them as their own health data is used by researchers. And just another primer on blockchain tokens is they're smart, right? That's kind of one of the other differentiators is one is they're decentralized, which we talked about with less or more difficult to hack, with a high payoff. But then also you can program them to be smart, right? With credit card transactions, it's hard to set up these automated processes where you get paid every time someone uses your data. But when the money already has that programmed in, or these tokens already have it programmed in, it makes it a lot easier. And so that's sort of the technology that this company is trying to leverage to make it easier for patients to be compensated for their data. Does that make sense? All right, so I am going to copy this link for you all. Oops, I'm actually going to the link. And I'm going to paste it in the chat. And I want you all to take about 5 minutes to enter your own storyboard for a patient-focused digital health app. And this is one that's existing, right? So feel free to, Google on the internet, like patients, digital health, something like that. Find one that you like. Could be anything. It could be any of these different categories, whether you want to go social, data, digital therapy, whatever. And then just try to draw out your storyboard. And then if you like yours, raise your hand, and then we'll present it to the class. Okay, I think most people have answered now. Those who are still wrapping up, just go ahead and finish that up. I realized that I forgot to put the name on the form, so I added that for the next time. But would anyone like to share what they wrote down?
Yeah, I'd like to talk about one actually.
Sure, which one is yours?
The one, Myfitnesspal.
Myfitnesspal, okay, cool. So let me share the Myfitnesspal on my screen while you talk about it.
All right, cool. Well, when you asked about making a storyboard, I thought about this app because I've been using it since...
And everyone's it?
Yeah, cool. I've been using it since undergrad to help me track a lot of the food and nutrition. So when I was looking at the different possible areas it can fall into, it could fall under databases, patient monitoring apps for self-diagnosis and things like that. But basically what it is that it's a fitness app in which you can input the food that you eat as well as the exercise you've done. And it kind of lets you keep track of your calories, your macros, and you can even set goals for things like weight loss. So how I think it would fall under digital health is, in the scenario, I basically talked about how this woman or this patient or this male was diagnosed with prediabetes and wanted to change their ways before they become a full-blown diabetic. So part of that is exercise and nutrition. So the scenario is they would download this app, and you could actually even set a goal. So you can set a goal of, say, I want to lose 0.5 pounds per week or 1 pound per week. And then it will give you and then it'll ask you your body type, your age, little pre-existing conditions, things like that. And it will actually create you a plan for nutrition that goes from macros down to your calories, your fats, your proteins, and even can keep track of sugars and sodium levels and things like that. So that you always have kind of parameters on how you want to eat throughout every day. Then this person would basically download this app, and then they would put in their desired goal, and then the computer will actually, or the app will give them guidelines on how to eat and how to exercise that day. And then the next step would just be the patient attempting to eat healthier and then inputting all those nutrition guidelines or how much they've eaten into the app, as well as the types of exercises they were recommended to do, whether it be walking, jogging, swimming, weightlifting. The app can actually calculate how many calories lost when you exercise. And then the outcome is that the patient would be able to, the output would basically be that the patient would be able to keep themselves more accountable, because that's the overall goal, is self-accountability. So this is like the main app that I want to talk about, because to this day I still use it, and I always recommend it to a lot of my friends who are considering weight loss or fitness or things like that, because it's a perfect way to search up the foods that you eat, because the main difficulty is that when you're trying to eat healthier, sometimes like especially at a restaurant too, or you're cooking something at home, you don't really know what the calories are, what the macros are. But with this app, you could actually input, say, baked chicken breast, and then you could put, I ate 6 ounces of it, and it'll actually give you the average calories and the average macros. So it's a super helpful app for things like that.
Yeah, it's very cool. Now, let me ask you, Derek, can you think of anything in the app that you wish that it did, that it doesn't do?
It doesn't send your daily login information to another person. So if you wanted to make this a more full-blown, I guess, telemedicine kind of app kind of thing, or digital health kind of app, then linking it to your primary care physician would be super helpful, because then your primary care physician doesn't have to ask you, what did you eat that day? Or what exercise did you do that day? Since you logged it in already, and if they could just be sent directly to their office, then they'll basically know without you having to tell them that you're being accountable or not, and if there's anything they need to change. So that'd be pretty cool.
Oh, yeah. So I could imagine maybe creating a very rudimentary prototype of how that might look. Maybe showing the Myfitnesspal information, but in a way that a clinician would want to digest. And that could be a cool project. Cool. Anyone else want to go? This is a good opportunity, I think, to get your participation in for the day. No one else? It doesn't have to be as thorough as Derek's explanation. All right, we'll move on. Oh, there we go, Mohammed.
Yeah, sure. So I did a sleep cycle. You can go to sleepcycle.com. We'll bring it up. Yeah, so pretty much what this app does is that you can turn it on in the background, so you pretty much sleep with it on. It pretty much analyzes your sleep patterns. So it shows you how long you spend in each sleep stage. What I like about this app is that it really tracks on the long term how you're sleeping. It tells you in the morning what quality sleep you got. It gets more accurate over time. So pretty much like the data inputs that go in here is you can put in what you ate that day, how much coffee you drank. It pretty much aggregates all that data on the long term, and it tells you pretty much like what are the key drivers of what's increasing the quality of sleep. So what I wish it had is that it actual like insight. It would tell you stop doing this so you can get better sleep. It's kind of like you have to look at the data yourself and kind of come up with the insight yourself. But I've been using this for quite some time, and I think it's great.
Right, yeah, and you can see here too that it's got sort of a data analysis aspect to it too. So this is kind of on the patient user end, but then also on the data end. And I could see this being useful maybe to don't know about the government level, but sleep centers or other organizations within these countries that might be interested in this sort of data. Cool. Okay. And then I would just add, so you made the suggestion that, or you wish that it gave more suggestions. Now, if you wanted to build a prototype around that, you wouldn't need to rebuild the whole sleep app. I would say just kind of make up some of the data from the sleep app and see how would that be transformed into a user experience of what those suggestions would look like. So again, for these prototypes, it's more about, we'll just be creating one feature because most early prototypes are really only that one feature, and then you build upon that after you start to get traction with customers. Okay? Anyone else? Yes, Nia.
So the one that I found was called AliveCore.
Okay.
So basically it's like a portable heart monitor to measure your heart rhythm and see if you have any unusual heart rhythms. And it does it like a medical grade EKG reading. And it can tell you if you have things like bradycardia, atrial fibrillation, or just a normal heart rhythm. And it's pretty cool because it like allows you to track your testings, and you can send it to your doctor if you wanted to. And they do give you a readout every 30 days. So I don't know what I would do to improve it. It seems pretty thorough to me. So.
Yeah, and I imagine you probably don't use it, so it's tougher to know how you would improve it. But, you know, given more time, you know, maybe between this week and the next week, if this is something you're interested in, you know, look at all the features and think, is there another feature that might be cool? But of course, we're not limited to these individual things for what we want to do. Okay, anyone else, or should I move on to providers? All right, going once, going twice, moving on. All right, so providers, as I mentioned, these are the actual doctors. These are the people who provide healthcare services for us. So it's actually not just the doctors. It can be the doctors, the nurses, the pharmacists, really anyone who's providing healthcare service for the patients. Now, the first area that I want to talk to is practice management. This has really been, I would say, financially, one of the most successful areas of digital health. I think simply because it's handling something that's more of a business, has been more tried and true, you know, in other industries, and just applying it to healthcare. So here we talk about logistics, right? How do we handle different patients, waiting room type situations? How do we make appointments? How do we make sure that we're reaching out to the patients so that we can maintain a relationship when they're not in the hospital, they're not in the clinic, they're not at the pharmacy? How do we manage revenue, right? So just kind of basic business stuff that maybe is a little bit difficult for doctors because they weren't trained to be business people, but some of them find themselves becoming business people, even entrepreneurs, when they set up their own practice. So how do we help them run that, but while enabling them to concentrate on the medicine that is really why they got into the career that they got into? There's also patient self-service. So is anyone familiar with the concept of self-service? It's used in other industries as well. Anyone want to take a stab at that? What self-service might mean? There are no wrong answers. The only wrong answer is not participating. Yes, Mohammed?
Off the top of my head, self-service, it could be like instead of going to the pharmacy and getting a refill, you go online and get the refill and just comes to your house via mail. Could that be an example?
Yeah, I think that's an example. It's basically enabling the patients to take care of business on their own, right? So there's a lot of things that you don't need a physician or a healthcare provider in the room to do. So it's enabling to do that. So it might be what you just mentioned. It might be them entering the basic questionnaire data on their own before they even show up at the clinic. Basically things that we can enable them to do to streamline the process before they even get into the care setting. Okay. So what are we covering? Kairos. So this is a technology that is really addressing the problem of the fact that patient appointments are inefficient, right? So this is used by providers, and the data input is they put in their practice information as well as their appointment availability. So kind of like a calendar, right? And then the output is they get notified when there's interested patients, and they're also provided with scheduling tools that help them treat those patients in a way that is, amenable to their capacity and their availability within their practice. You kind of imagine something like Open Table, right? Anyone familiar with Open Table or Resi or any of those reservation apps? Kind of like that, where it helps you arrange who's going to come into your restaurant, or in this case, your hospital or practice, while also providing leads for incoming patients. So the storyboard is a physician practice needs a better way to interact with patients. What happens next? The physician inputs their information onto the platform. Then patients will find the practice within the platform, again, similar to what you might see with Open Table, and then they'll book appointments through that platform. The desired outcome is you get more patient throughput through better scheduling. So you've got this lead of patients that can come into your practice, and then you also have just a more efficient way to schedule so that you don't have a scenario where, say, no one's coming in on Tuesday, but you're overbooked on Wednesday. Helps you smooth all that out. Any questions on that? So here we're kind of focusing on the logistics of running a practice. Again, this is one of the more mature areas of digital health, simply because it's not that dicey, right? It's scheduling software. There's nothing dangerous about making that. You don't have to deal with regulation or anything like that. So it's been easy. It's very mature. It's easy to measure what benefits you provide, right? In this case, more appointments with the finances on the bottom line. So it's a much more traditional way of using digital to improve the business. Okay, next, telemedicine. So this is very front of mind with coronavirus. Here we talk about virtual care. So getting care with a doctor, behavioral care itself, or maybe just initial assessments online rather than having to go into their practice. Patient apps also exist. So here it's kind of the same thing that we talked about on the patient side, but apps that enable you to do treatment without actually making the patient go into your practice, your hospital, your pharmacy. Digital therapies also fall under this category. We already talked about those. There's also remote monitoring. So here is where we talk about kind of like what Derek was saying about, Myfitnesspal, right? So that's kind of a remote monitoring. So you don't need the patient to come in as often if they say have diabetes, but they're streaming their information over to you as the provider. You can get a better handle on it. That also goes back to that that addiction treatment app that I showed you in the patient section. And then drug adherence also would fall under this category. Anyone got anything they want to bring up before I show an example in telemedicine?
I heard that there was like some kind of device. I don't know if it's actually been released onto the market or they're just trying it out or what. But it's basically kind of like a robot that would follow, like it's mostly for people who are elderly or would otherwise need some kind of like in-home service, to kind of like make sure that they're okay if like it notices that they fall or something, or to remind them of medication. Would that be considered virtual care?
Yeah, you know what? It's actually a good question. I don't know where I would put that. That's definitely something that's being used. I might call that, yeah, somewhere between virtual care and then maybe also logistics, right? Because you're having the robot take care of certain tasks that might be below what a human would normally want to spend their time doing. I've heard of a lot of these robots also being used in children's hospital settings as sort of like buddy robots, or just ways to lift the spirits of the kids. I've also seen them used in security, which is a little bit more scary, although they're not that scary right now. I've seen them roaming around. I think I saw one at the Atlanta Aquarium, just, I guess, making sure people didn't sneak in through the back entrance or something, but it kind of looked like a R2-D2 from Star Wars. Wheeling around. So kind of creepy, but also kind of cool, for sure. Okay, so Technology storyboard. So here I want to talk about SnapMD, which is actually an LA company. And the problem that they're addressing is that in-person medical attention isn't always needed. So how can we move some of this medical attention into telemedicine, basically, right? So that the patients can get this attention from their home, from their couch, in a place where they're more comfortable, and also it's less costly to care for them. So the data inputs are simply patient and physician availability, as well as medical data that you can use in their dashboard. The outputs are live interaction between that physician and that patient, as well as analytics to improve the patient consults. So you can imagine it's kind of like with this, right? I can talk to you all without you all being in the classroom, and I can also do other cool things with Zoom, although we're all getting used to it, but I can create polls, things like that, to make our class more efficient. And then in this case, obviously there's medical data, which just adds a whole nother layer of sophistication to what they're able to do in these consultations. So the storyboard is a physician wants to expand their telemedicine practice. What happens next? They create their profile and their capabilities as a physician, as well as their availability. After that, the patients will schedule visual appointments or virtual appointments with that physician. And the outcome is that there are actual appointments that are done virtually that lead to more throughput and a more efficient patient care system. And of course, you can see desirable outcomes in what's going on with coronavirus too. People can get their fears allayed, or they can talk through their symptoms without actually seeing the doctor. And that way it enables us to keep our social distancing. Okay, next, specialty care. So here I'm really talking about personalization, right? So it's sort of moving away from that one size fits all care and figuring out what's a better way to care for each individual patient as an individual person, right? Back in the 90s especially, this is where you had your blockbuster era, where it's like one drug fits all. We treat all diabetes patients the same. We treat all cancer patients the same. There wasn't a lot of differentiation. Now we're realizing that that's just not how the human body works. That's not how biology works. We need to treat everyone as their own individual case, right? Two people might have melanoma, but they might have different mutations within the melanoma. One might be white, one might be Asian, one might be Hispanic, one might be African American. Those different features actually impact the way that we can best care with them, right? These genetic differences have been proven to lead to different outcomes with the same treatment regimen. So there's a lot of tools now that will help physicians make these decisions in ways that are more individual to the patients that they are treating. Now we're starting to get more in the weeds, but does anyone have any companies or platforms that they know of that they want to talk about? All right. I'll talk about Viz.ai. So this is an AI company, obviously, because of the .ai. And the problem that they're looking at is that process delays can cause patient deaths. So it's a provider tool, and the inputs are, this is actually a brain scan leveraged app. And they get the patient information as well as brain scans and whatever updates need to be provided for that patient. And their outputs are actual disease detection and messaging that help coordinate the care teams. So rather than, say, getting a brain scan, sending it off to a different department that analyzes those brain scans, time is lost. This enables you to do things very quickly, get the patient under the knife from the neurosurgery department as soon as possible to potentially save their life. So Storyboard is the neurosurgery department wants to improve their patient flow. The physicians upload their brain scans to the platform. That platform uses AI to detect abnormalities and recommends next steps. The patients are then given their life-saving surgeries sooner, and the survival rate is increased. So this is kind of where I think you see the forefront of AI in healthcare. It's one, image analysis. So AI has proven the most effective in image analysis. We've been able to I think, do a lot of automation in radiology analysis, brain scans, things like that, that we just couldn't do before. And a lot of that, frankly, derives from Google's effort to identify cat pictures, right? I think that's where it all started, is Google started asking, okay, well, of all these pictures on the internet, what's a cat, what's a dog, what's a person? And that's kind of been the foundation behind a lot of new companies like this that are now taking that one step further to figure out what's a good brain scan versus what's a bad brain scan, right? What's a good MRI of a knee versus what's a bad MRI? And that just enables us to get critical care to the patients that need it much more efficiently and much more quickly. Any questions on that? All right. Decision support. So here we talk a little bit about, remember when I was talking about what happened in the 60s and 70s with the implementation of clinical decision support software. So at that point, it's really just a very simple algorithm that was basically printed out and used as a flow chart. Well, now we're doing this all digitally. So it's orders of magnitude more complex, but also orders of magnitude more user-friendly, because you can just spit out answers based on proven flows of decision-making for these physicians. It also takes some of the variability out of clinical decision-making, right? Now, there's certainly risks here, right? I don't think anyone would argue that we need to get rid of the people making these decisions and just replace them with machines anytime soon. But these are really partners for the physicians. They help the physicians make the right decisions and or catch certain risks in the decisions that they are making. Any ideas or questions about what might fit under this category that you want to talk about? Yeah, again, this is kind of more in the weeds, but I'll show you some examples. All right, so this one is called OncoLens. So the problem that they're solving is cancer coordination is poor. The reason why it's so poor is because you just have so many different members of a patient care team, right? You have your internal medicine person, you have your surgery person, you've got the person who's doing the diagnostics, the biopsies, the MRIs, the brain scans, so on and so forth. There's at any given time, probably about half a dozen, if not more, physicians that are caring for a cancer patient. So the inputs of this app are the patient info. So what's up with the cancer's patient, or the patient's cancer? Who are the physicians that are caring for this patient? What is the info on their tumor? And then the output is organized, coherent updates to that care team so that everyone gets the same information at the same time. It also helps by suggesting clinical trials that might be relevant for this patient. So if we go to the storyboard, basically you're seeing as a cancer team forms for a new cancer patient. As soon as that happens, tasks are created through this OncoLens platform for that care team, and the data for that patient is uploaded. After that, the platform actually provides clinical decision support and coordination. So suggestions of what to do, who should do it, right? They might actually help the person who's running the test actually order that test. They might say, hey, we recommend that you order an MRI or a brain scan, whatever. And they just help smooth out that process. And of course, now everyone on the care team has visibility because they're all looking at the same platform. Desired outcome is that duplicate work is avoided, and then the treatment therefore progresses faster. So better coordination, less redundancy, faster moving treatment regimen. Any questions? All right, last item for providers, information. So here, remember, the patient parallel was really your web portals, Webmd, things like that. With physicians, it might be kind of along the lines of like Epocrates that I think Derek mentioned. And also e-learning tools. So when we talk about physician training, social networks for physicians themselves to help them share information about maybe difficult cases that they have with patients, obviously keeping identities private, but kind of trying to crowdsource information from their fellow physicians, as well as EHR platforms. So here's what we talk about. What can we build upon electronic health records to get better outcomes from all the data that's stored within them? Any ideas or anecdotes that you want to talk about from the information perspective with physicians? All right, so I want to talk about GibLib. So GibLib is essentially a YouTube for physicians, particularly surgeons. So the problem that it's solving is that there's no centralized place for surgery videos. It's made for providers. And like I said, it's YouTube, but it's focused around surgery videos, even virtual reality. They also take inputs from the surgeons themselves. So if I'm, say, a heart surgeon, that it can help give me the proper videos around heart surgery that can help me train. The outputs are continuing medical education training. So this is, by the way, CME training is something that's required of all physicians. They have to kind of keep abreast of what's the state of art within their specialty. And GibLib helps them do that. So the Storyboard is a surgeon signs up for access to surgery training. After that, they can view curated training videos, including VR, and then from that, they earn CME credits. So the desired outcome is that these surgeons now have a centralized and curated location to train online. And you can imagine this would be very helpful because in the past, for a surgeon to really get any useful training, a textbook is not very helpful for surgery training. They have to be in the hospital. They have to be particularly in the OR. With something like GibLib, you can imagine they could really become familiar with a particular surgery by watching it over and over and over again, kind of like an athlete watching game tape. And that can enable them to ramp up their training much quicker than they otherwise would. So I think you can see from that how these digital health solutions are so variable. They really cover a vast world within healthcare. It's not just trying to digitize a care process or some of the portals that we're so familiar with like Webmd. It really runs the gamut. Pretty much anything digital has done to help other aspects of our lives can also be applied to healthcare. It's just been slower. And a lot of that has been due to regulation, but the government and the FDA specifically have been a lot more embracing of digital improvements into healthcare technology than they used to be. And so I think that's been very helpful to jumpstarting this digital revolution in health. So I want you to take another 10 minutes or so to look up, do some Googling, look up a company that you find cool or a platform you find cool that provides help for providers, and we'll report on that in about 10 minutes. And then this will probably be the last thing we do. We'll cover payers and producers in our next lecture. Okay? Good. My Zoom quit on me, but fortunately that resolved itself fairly quickly. So would anyone like to present on what they've got?
I can go.
Yes.
Okay, so I picked a platform that providers use quite frequently. It's called UpToDate. And what this platform does, it's basically like if a provider is like maybe unsure about a disease or like needs like a quick like summary of what's happening again, they could just go on this website and it gives them like a rundown of like the current guidelines, any changes that have occurred in terms of treatment. And then it also provides like some drug information and like provides like the provider with like how to evaluate the patient. So like take for example, like a big thing right now on the UpToDate website is like the coronavirus. So like a patient comes in with COVID-19 and the provider is like, there's like things that are happening like on a daily basis in terms of like what are the treatment plans and any changes that have occurred. And this is a platform that is like changed on a daily basis and like things are added to it. So provider can go on here and easily see like if things have changed in terms of treatment plans and like recommendations for patients.
That's very cool. Thanks for sharing that. Can you all see my screen now? Thumbs up. Okay, cool. Yeah, I had to recover my platform on Zoom. Okay, how about anyone else that hasn't had a chance to participate yet? This would be a good opportunity to get your participation in for the day.
I could go.
Yes, Kevin.
So I picked epic.com. It's an EHR platform.
All right.
And apparently they've been doing health IT for like 50 years, and so they're really big on helping physicians just convert their patient records into electronic health records, and they have a dedicated software and support team that's able to do all that.
Yeah, very cool. Epic, I think when you picked really one of the behemoths in the electronic health record world. I mean, you probably see Epic in at least a third of all hospitals, and they really carry a lot of the weight in terms of what goes on in the hospitals and how do they keep track of all that data. So this is really a behemoth, and you can see how many different things that they do. And this is just in telehealth alone, all of the different tools that they offer. So Epic's a really interesting company that I would encourage you all to take a look at. In fact, Epic, this site that Kevin referenced, epic.com, I think is a good site for you all to go through if you want to see what all is out there. Because, you know, a lot of the major players in digital health, I would say this is a bad thing, but it's just what it is a lot of them do everything because hospitals, when they find tools, they want that tool to be all encompassing because they don't want to have to deal with 15 different digital health tools. So Epic is certainly one of those. Thanks, Kevin. Anyone else who hasn't gone preferably? Samantha, anything you'd like to share about your... You're on mute.
Sure. I found a website called Ask a Doctor. It basically, like, you can just virtually chat with a physician when you like need help. But I've seen like commercials where insurances can contact a doctor for you, and then you just talk to them virtually and then tell them your symptoms. That way you don't have to go in or go to urgent care. And they will just tell you like what you have, what's wrong, and then they could basically give you a referral in a sense, but like this website I found is just telling you if you actually need to go in or not. It's not something like here's a referral, this is what you should do next. It's more like you should go to a doctor if it's serious, but if not, like they'll just tell you like you just need fluids, rest, sleep, and should eat like not solid foods or something like that.
Gotcha. Yeah, that's very interesting. It's almost like a smarter version of WebMD where I can put my symptoms in and then get an answer. And in some ways it's like patient self-service, so that as a patient I can figure out what my next step should be rather than inappropriately asking a doctor, you know, if it's not actually an issue, that this thing can kind of let me know that and give me that assurance.
Yeah.
All right, cool. Let's see, who else do we have? Serene?
Yes, I I found this one, but I didn't do my report on this, but ppid.com, PEPID.com. And it's basically, they say answers that empower action. So you can get medical and drug information resources that they have. You can go and find out information about it. I just couldn't figure out if this is for physicians, providers, or for the patients. I believe it's for providers. Yeah.
I would say it looks like it's for physicians, right? Because you have some keywords like clinical decision support. I see here, and improving patient outcomes, data integration. So this is it looks like it's a combination between clinical decision support as well as data. So that's a great example. Okay, and then Sifuni.
For me, I was looking at this website called SWYmed.
SWYmed, okay.
And what I found is like they were explaining about explaining about the emergency care teleprovider, by which, for example, if you have an accident and then you're supposed to be transferred maybe from the place you are to the hospital, they connect with the doctor. They can see you through the video assistance or any other situation so that they can stabilize you before you reach at the place.
Oh yeah. So this is probably pretty relevant to what's going on right now, huh? With coronavirus.
Yes.
In fact, they've got this telehealth rapid response. So it looks like they might be trying to help a lot of these health networks with their response to coronavirus to enable them to triage over video before they actually have someone come into the clinic where they might be in danger or a danger to healthcare personnel. So that's a great and very relevant example to what's going on right now in healthcare. Okay, and then how about Madeline?
So I did mine on those MERX. I'm having trouble loading the page, but so far what I just got from it, so
how do you spell it?
Hello?
How do you spell it?
Those MERX.
Those me. Okay.
Those me, yeah. Those me.
MERX. Gotcha. All right, so let's talk about it.
Yeah, I did that. Okay. Yeah. So what it does, what I got out of from it is that it enables clinicians to optimize the patient's dose. So it reduces the time that's spent on the dose adjustments, and then it minimizes the number of assays required for a range of drugs that require the therapeutic drug monitoring. It was taking a while to load, so I wasn't able to look at it more thoroughly. But yeah.
Well, it looks really cool, and I think this is actually a really good example of what could be done on a prototype, right? So when we create our prototype, it's really all about simplicity. Let's not try to create another Epic, right? Because they're huge and they do a little bit of everything, but maybe just one feature within Epic. And I think DoseMe RX is a good example of that, because really they've tried to be limited in their scope. Let's just take on dosing, figure out a way to maximize, how dosing impacts the patient's outcome, and then help the physician do that. So I think this is a good example that might also be a good benchmark when you all end up picking your project. Okay, so we're coming to the end of our time. Like I said, we'll return next Monday and handle the payers and the producers. Those will be a little bit shorter. There's just less going on with the payers and producers than there are with patients and providers. And so most of what digital health is doing relates more closely to directly dealing with patients and providers. So for homework, just to let you all know, I uploaded Lean Startup Chapter 6 onto Sakai. So you should be able to access that from Sakai. Then I also want you all to set up a free account on Code Academy. So you'll have these slides. You can take a look at the link and how you do it. But I want you to start learning HTML. So all you have to do to prove that you've completed these 2 lessons, I would say that, so Lean Startup, that chapter, it's only about 20 pages at most. So that shouldn't take too long. And I don't even think it's 20 pages. And then the HTML, it's really only 2 lessons. I don't think they should take any more than 20 to 40 minutes as well. So I want you to complete those lessons. Let me know, of course, if you have any questions. Just send me an email. I think that'd be the easiest. And then when you've completed it, as your answer to the homework, just paste your profile link onto Sakai. So if you go to your profile by clicking in Code Academy, the upper right corner, My Profile, and then click on Badges. You're gonna see these badges. And if you post your link to Sakai, I can then click them and make sure that you've completed them. So you can see here, like lesson complete, introduction to HTML. That's what I wanna see, is I wanna see your profile with the badge that shows that you completed the lesson. And then this will kind of be the start of your coding journey. I'm not gonna start the lecture for coding until the second half, so week 4 or 5. But I want you to get a head start because Code Academy, it's very friendly, doesn't require any prior knowledge. And then I can sort of talk to those of you who are struggling a little bit on the learning before we get into it as a class so that I can make sure that everyone's on the same level. So any questions about that?
One quick question. Where exactly do you want us to paste the link to on Sakai?
So on assignments, there's a way for, have you all, and like, I don't really know how you all use Sakai, to be perfectly honest, so I'm kind of learning with you here. But I saw that on Sakai, you can create assignments and then post answers to those assignments. So what I've done is I've created an assignment for the first 2 lessons of HTML, and then I just have one answer that I need from you on that assignment that says post the link. If you can't figure out how to do it, to be honest, just email me with that link, and then I'll just click it from there. That's probably easier anyway, but I just want to be consistent with what everyone else is doing with Sakai. So let's try to do it that way. If we can't figure out a good way to do it, then we'll just go to something a little bit more basic like email. Cool? And I can't see your faces right now. It's just a Zoom technicality error. So, or actually I can only see Mohammed because I think he just docked. So if you have any issues, I can't really read your faces, just speak up or send it in the chat. I'll stay on for another 10 minutes or so in case you have any questions that you want to address through chat or with me individually. But that's pretty much it. For the Lean Startup chapter that I'm having you read, just to be transparent, I'm going to begin the lecture with a poll. And the poll is just going to be a couple basic questions about Lean Startup. It's not really a right or wrong answer thing. It's not, I wouldn't call it a quiz. It's more, I want to use this to get participation. So I'm going to have you all answer the poll. Then I'm going to call on you individually who might have answers that I'm interested in, and then we'll go from there. So come prepared because you're going to need to address the poll. Okay? Any questions about that or about what we talked about so far? That pretty much concludes the lecture. I want to say that I'm very pleased with the level of participation. I know it's can be difficult to participate on Zoom, but I thought we got a lot of good participation. Everyone participated, so right now your grade is an A+, 100%. So good job, everyone. it'll get a little bit harder as we get into the projects and stuff. But yeah, I'm happy with the questions. I'm happy with the contributions. I think if we continue on this path, this is going to be a great class. I'm excited.